Good morning and welcome to Karen's Corner. I want to introduce one of my longtime friends, Miss Katheryn McLendon. How you doing today, Katheryn?
Doing great, Karen. Thank you for having me.
Yeah, it's really good to see you, even though it's virtual.
Yes,
Better than not at all, right?
absolutely, absolutely.
Wonderful. So I know you've been doing this a long time. So how long have you been in the counseling field?
I've been in the counseling field for 15 years now, done a variety of different things. I was in a group private practice setting for 6 years in South Haven, and then went back into the corporate life for a few years and did some clinical management, was at Parkwood, and then most recently at Daybreak Treatment Center as a clinical director. Now stepping back out into private practice again, um, with two locations. Primarily in Germantown. I'm at the Exeter group of 2014 Exeter Road over here with several other clinicians. And then also have a practice a couple days a week. I'm in South Haven off of Church Road.
Okay, very good. So very versatile. And both of those are really, really good locations. And they're very easy to get to. So that's wonderful. So what kind of drew you to this field? I'm interested.
Yeah, so honestly, I started off in psychology, sociology, and undergrad. I had a summer internship at DeSoto Sunrise Home for Girls back in the day. It was in Hernando, Mississippi, working with sexually abused teenagers. And I remember kind of having a very difficult day. And after even at the most difficult day, being able to come home and saying, "Wow, this is something I could really do. I feel like I can make a difference in the lives of others." And so that sort of drew me into the counseling field.
That's phenomenal. Excellent. Well, you definitely have a caring heart. So what are your specialty areas?
So my specialty areas, of course, I'm EMDR trained, so obviously work a lot with trauma. Back when I was in private practice before, I did a lot of sexual abuse, neglect, that kind of work with younger children. Also enjoy working with trauma with adults, secondary trauma for like our essential workers and even our therapists that have, are struggling with different things related to the pandemic and other areas of our life. Um,
Gotcha.
Also, depression, anxiety, mood disorders. Seeing a lot of anxiety here lately.
I would imagine so, yes. Particularly, when everything is just so up in the air and there's no real resolution that we can see even in the far off future. So yeah. So you're seeing anxiety. Are you seeing any other conditions increasing as a result?
Depression as well. Of course, I work with adults and children, so I'm starting to see some children with that are struggling with anxiety just due to the changes with school in
Oh, I can
particular.
imagine. Oh, yes. Well, and I'm sure they're also picking up on the anxiety that their caregivers are
Caregivers,
experiencing.
absolutely,
Yeah.
absolutely.
So, are you mentioned earlier you're also doing telehealth. So, is there a difference? Or, of course, there is. That's a crazy question. Let me rephrase that. What differences are you seeing between in-office therapy and telehealth?
Sure. So most of my telehealth clients have been existing clients that I'm seeing ongoing. I am seeing that with the telehealth clients when I'm doing the EMDR via telehealth, it takes a little bit longer for the process to work, simply because they're having to do their own bilateral stimulation as opposed to being in office and being able to do that for them. Um, and generally speaking, I think some people are choosing telehealth because they're anxious about
Mm,
coming face to face.
sure.
So I'm glad that I'm able to provide both services to really meet people where they are based on their need and their level of comfort.
Gotcha. Very good. Okay. And so, what insurance providers are you in network with?
Currently in network with Cigna and Optum. And Optum, of course, is United Behavioral Health, United Healthcare, yeah, and UMR. So
Okay. Well, that's good to know. Excellent. All right. And what's the best way to schedule an appointment with you?
The best way to schedule is by calling, and my number is 901-250-5649. And that's my business cell. So regardless of what office, if it's Germantown or South Haven, they can call that number, and we'll get them set up, whether it's face to face in one of my office locations, or if they are wanting telehealth.
Okay, excellent. Well, very good. Anything else you want to mention before we wrap up?
Sure. I do want to mention my South Haven office. I see ages 13 and older, and my Germantown office, I'm able to see children as young as 3. I am a play therapy trained provider, so I
Excellent.
can see children as well as teens and adults in Germantown.
Wonderful. Very good. Good to hear. Well, Katheryn, it was so good seeing you. I really appreciate your time today. And hopefully we'll actually get to see each other in person
Yes,
soon.
yes, absolutely.
Well, thanks again. You take care.
Thank you, Karen.